Okay, welcome back, everyone. We're going to be taking a look at some anatomical terms and anatomical reference terminology. It's really important to look at this young lady right here and see the position that she is standing in. This position where we see she's standing erect, the feet are flat on the floor, and her hands are facing forward or they're facing anteriorly. You're going to hear that word. Her hands are facing anterior and they're also supinated. They're supine. They're facing up. This position is anatomical position. Everything that we're going to study is assuming that the body is starting in this position, in anatomical position. Okay. So anatomical position is when the hands are down at the side and the palms are facing forward. There's another term called supine, supine and prone. Both of these are when the individual is laying down, but supine is when you're facing up and prone is when you're facing down. So supine is when you're lying on your spine. When you're supine, you're on your spine, which is face up. When you're prone, you're on your bone, which is face down, the bone being your nose. When you're prone, you're on your bone lying face down. So when you're lying face down and you're lying on the bone, that is prone. When you're lying on your spine, that is supine. So supine is on the spine, that's lying face up, and that's the opposite of prone. So prone is when you're on the bone, that's lying face down, and that's the opposite of supine. Then what are you left with? We're left with anatomical position, when you're standing upright with your feet flat on the floor and the palms are facing anterior, which means it's facing forward. Let's look at some of these terms here. We'll put some check marks next to what you should be very comfortable with. So the forehead is known as frontal. So when we do the skull, you will learn about the frontal bone. The frontal bone is in here. When we talk about the nose, it's nasal. So you may have heard of the nasal septum. When we're talking about the eye, we could use the term ocular or orbit. When we're talking about the ear, it's otic. When I look into someone's ear to see if a baby has, let's say, an ear infection, I have to use an otoscope. Oto is for the ear. When we talk about the skull, we say cranial. And when we talk about the face, we say facial. When we combine the skull or the cranium with the face, this whole entire structure, which we know is the head, but we use the term cephalic. Cephalic means head. So if you're getting to headache, well, I'm sorry, if you're getting into healthcare and someone has cephalgia as a diagnosis, you see the word cephal, which is head, but algia means pain. Anytime you see algia, it means pain. So cephalgia is a headache. If you see arthralgia, like arthritis, that's joint pain. When you see neuralgia, that's nerve pain. Fibromyalgia, muscle pain. Okay. When we talk about the mouth, we say oral, and we talk about the chin, mental. So when we do osteology and we learn about these two holes, one here and one here, a hole is called a foramen. When it's on the chin, it's called a mental foramen. Cheek is buccal. So when we do muscles, we'll learn about a cheek muscle called a buccinator. When we talk about the neck, we'll talk about the cervical vertebrae, C1 to C7. There's 7 cervical vertebrae. The chest is called the thorax, and we know that we have T1 to T12. We have 12 thoracic vertebrae. The breast is called mammary. We have mammary ducts. The abdomen we call abdominal, and the belly button is umbilical. This whole region together, we can call it the torso or the trunk. The armpit is called the axillary region. So when we do blood vessels and we learn about the axillary artery, or in neurology, the axillary nerve, we have an idea as to where it is. In the arm, brachial. So we learn about the brachial artery, or a muscle called the biceps brachii, or a muscle called the brachialis. We know where the brachium is. It's the arm. In front of the elbow, it's called antecubital. Antecubital. So this part of the skull is called frontal. The eyes are called orbital. The nose is called nasal. The chin is called mental. The ear is called otic. The cheek is buccal. So now we just have a few left, and even though we didn't learn it, we could probably figure it out by process of elimination. So right here is the sternocleidomastoid muscle. We see that here and here. Here's the upper traps, and then here's the clavicle. Kind of makes like a triangle. So anterior means in front. So this is anterior. Lateral means off to the side. So this is the lateral cervical triangle, and this is the anterior cervical triangle, right? You could figure it out by process of elimination. Let's look at some of the anatomical terms for the rest of the body. When we look at the wrist, it's carpal. You've heard of carpal tunnel syndrome, CTS, carpal tunnel syndrome. Well, we have 8 carpal bones in the wrist. There happens to be 2 rows of them. One row is more proximal, and one row is more distant or distal, and there's 4 in each row. The palm is called palmar. The digits are referred to as phalanges, and the thumb is called pollicis or pollex, pollicis or pollex. The groin is called inguinal. The pubis is called pubic. The thigh is called femoral. The longest bone in the body is the femur. So this is the femur, femoral. The kneecap is patella. The leg is crural. The ankle is tarsal. So don't confuse tarsals with carpals. Okay, don't confuse carpals and tarsals. Tarsals are down here with the toes. So tarsals. The great toe is hallucis or hallux. So hallux is the toe, pollex is the thumb. So remember P and pollex for P for palmar. Think H hallux is the great toe, which is with the foot where the heel is. So H and H, heel, hallux, right? Just make those silly connections. The digits of the toes are also referred to as phalanges, but the foot is called the pedal foundation. And it looks like the word pedal because you pedal with your feet. Okay. Hand is called manual. Again, the head is cephalic, the neck is cervical. There's the upper extremity. The highest part of the shoulder is called the acromial. The back is called dorsal, just like the dorsal fin of a dolphin. Dorsal. The opposite of dorsal, so we have dorsal, which is the back. In the front, it's ventral. Another way of saying dorsal is posterior. And another way of saying ventral is anterior. So they're opposites. Posterior and anterior opposites, dorsal and ventral are opposites. Okay, the back of the elbow, if you're leaning on a desk, that's called olecranon. Olecranon. Because the back of the elbow, that bony part that you can feel, is called the olecranon process. Okay, this lower back is the lumbar region. We have L1 through L5, 5 lumbar vertebrae. The tush over here, that's the gluteal region. So when we do the muscles of the rump, there's the gluteus minimus, gluteus medius, and gluteus maximus. So when you hear about the gluteal muscles, you know where they are. The back of the knee is called the popliteal region. And there's a muscle called the popliteus muscle that's right back here. So popliteal is the back of the knee. The calf is called sural. The heel is called calcaneal. And the bottom of the foot is the plantar surface. Still with terminology, we have superior and inferior. These are opposites. When we're talking about the body as a whole, we can move superiorly or we can move inferiorly. But when we're talking about the extremities, we use the word proximal and distal. Proximal is closer to the trunk, distal is further away. That holds true whether we're talking about the upper extremity or whether we're talking about the lower extremity. So the femoral head is proximal, the tarsals are distal. The palm is distal, the humerus is proximal. Now we have medial and lateral. When you're moving towards the midline of the body, you're moving medially. And when you're moving away from midline of the body, you're moving laterally. So the nose is medial, the eyes are lateral. The pinky is the most medial finger. The pollicis is the most lateral. The hallux is the most medial toe. The pinky is the most lateral toe. If I'm at the pollicis and I move proximal, I can get to the patella. If I move more proximal, I can get to the femoral head. If I move medial and superior, I can get to the umbilical region. If I move superior to that, I can get to the sternum. If I move superior to that, I can get to the SCM muscle. If I move lateral to that, I can get to the acromion process. If I move distal, I can get to the antecubital region. See how we use the terminology? So again, superior, inferior. When we're looking at the trunk, when we're moving forward, we could say we're moving anteriorly or ventrally. When we're moving backwards, we're moving posteriorly or dorsally. In relationship to the trunk, you can move cranially or you can move caudal. Caudally refers to like the tail. Caudal means tail, cranial or cephalic means head. Good place to take a break.